The knee is the largest joint in the body and one of the most complex. Sprains and tears to the ligament are common sports injuries. And in the past, hurting the knee could have put an end to an active lifestyle. Today, medicine can return an athlete back onto the competitive field at top level. Joining us now is Dr. Alan Saperstein, Chief of Orthopedic Surgery at Boca Raton Regional Hospital, to tell us more. First of all, Doctor, thank you for joining us today.
Pleasure to be here.
A few questions about the ACL. First of all, what are the signs and symptoms of an ACL tear?
Well, the ACL, or anterior cruciate ligament, is the biggest ligament in the knee and the most important one. To injure it really requires a significant trauma. When it happens, you know something happened to your knee. Typically, it's a non-contact injury. An athlete is running and abruptly changes directions. He'll hear a pop, feel immediate pain, and the knee will collapse. Typically, they can't get up and start walking or running on the knee again, and it'll swell up very quickly.
Gotcha. And that will be a diagnosis, and my question is will it heal on its own if you don't have immediate treatment?
The ACL does not heal on its own. It's bathed within the joint fluid of the knee, and that really acts as a deterrent to healing. So in order to restore the ACL, you actually have to rebuild it and create a new ACL surgically.
Leading to the next question, do you definitely need surgery for an ACL?
Well, it depends on the individual. If one is very sedentary, doesn't engage in sports with jumping, pivoting, and twisting, you could live without your ACL. The typical patient who experiences an ACL tear does it in sports, and usually it's the sports that require jumping, pivoting, and twisting. So to return to those sports, yes, you do need your ACL. You do need surgery.
Returning to sports, obviously, if you tear an ACL, is a top priority if you want to get back on the field. So how long of a recovery time can you look at after an ACL surgery?
Well, the complete recovery to get back to your sport, particularly those involving jumping, twisting, pivoting, is 6 months. You need to give the ligament that you put in there time to mature and build up strength to withstand the forces that you're going to put on it. That doesn't mean for 6 months you're an invalid or on crutches. The short-term recovery of time on crutches and bracing is just a few weeks, and we rapidly progress patients through physical therapy, starting a running program, doing weightlifting, doing agility drills, leading up to their return to sports at 6 months.
And quickly, time for one more quick answer. Any difference between a male donor tendon that can be stronger than a female's when you're doing that procedure?
It's an interesting question. We generally don't differentiate in terms of our donor tendons between men and women, although women are more susceptible to ACL injuries than men, and so it does call into question perhaps there is a difference in tendon strength.
Okay, Dr. Saperstein, thank you for joining us. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.